Good evening, everyone. My name is Dr. Arthur Vaughn. I am the Health and Wellness Chair for the 100 Black Men of North Metro Atlanta, Inc. And I'd like to thank you for coming to our April edition of our Health and Wellness Conversations. Today, we're going to talk about hypertension and diabetes, what it means for us. At this time, I would like to turn the microphone over to our chair, also a member of the 100 Black Men of North Metro Atlanta, and one of our core mentors, Willie Robinson.
Thanks, Art, and good evening, everyone. Again, I'm Willie Robinson, as Art mentioned, member and core mentor with the 100 Black Men of North Metro Atlanta chapter. I have the distinct honor and privilege of introducing Dr. Clayton Ramsue, whose medical wisdom I've benefited from by way of he and I both being members of Alpha Phi Alpha Fraternity Incorporated, Omicron Nu Lambda chapter, seated in Marietta, Georgia, and serving the greater Cobb County area. And one thing I can tell you is that Dr. Ramsue applies consistent pressure in terms of encouraging us to develop and maintain a healthy lifestyle. Dr. Ramsue is a native of Philadelphia, Pennsylvania. His journey in medicine began when he enlisted in the United States Navy after high school, where he served over 6 years as a hospital corpsman and surgical technician. After Desert Storm, he matriculated at South Carolina State University, where he received his undergraduate degree in biology. He furthered his education at the Morehouse School of Medicine, and during his time there, he received the Primary Care Award and also had the distinction of being the first African-American medical student to serve on the board of directors for the American Academy of Family Physicians. He received his residency training at the Mayo Clinic and subsequently returned to serve his country in the United States Navy as a medical officer. During his tour of active duty, he received his master's degree in healthcare management from Troy University. Since leaving Active Directory, he has served in various leadership capacities, including Regional Medical Director for Correctional Medical Services, Vice President of Medical Affairs for Peach State Health Plan, Contract Medical Director for Fayetteville and Carl Vinson VA Medical Center's Emergency Departments, Medical Director for Fulton County Jail, Medical Director for MedPost Urgent Care Centers, and President of Brailer Healthcare Solutions, He holds additional certifications as a certified physical executive, certified healthcare quality management, certified correctional healthcare professional physician, master project manager, Six Sigma Black Belt, Lean Six Sigma Black Belt Healthcare, certified executive coach, as well as being a fellow with the American Academy of Family Physicians and American Academy of Project Management. Currently, he is the statewide medical director for Centurion Managed Care and CEO of Ramsue Consulting Group. He continued to serve his country in the U.S. Air Force Reserve until retiring in 2015 at the rank of Lieutenant Colonel. Dr. Ramsue has also authored 2 books entitled In Spite of, Answering the Call to Lead, available on Amazon now, and Living Your Best Doctor Life, Finding Passion and Purpose in Medicine Again, available on Amazon on May 10th. Dr. Ramsue is a proud member of Alpha Phi Alpha Fraternity Incorporated and Elizabeth Baptist Church. He and his lovely wife, Tanya, share 7 children. Dr. Ramsue, it's a pleasure to have you with us this evening to share some of your medical knowledge and wisdom on 2 medical conditions that affect members of our community at higher rates than others. And I'm sure all of our attendees are eager to get started. So if you would, please give us the rundown on hypertension. What is it? What are the symptoms? How do you develop it? And what are the steps we should be taking to prevent and manage it?
Well, thank you very much. I appreciate you for inviting me, first of all, and also for taking the time out to listen to a subject that is very, very pertinent to our population, not only as African Americans, but definitely as African American men. So what I would like to do is go through some of the symptoms and some of the background of both disease processes, and then talk about more importantly, what it means for us. And how we can mitigate some of these disease states, because a lot of them are preventable. So what I will do is go through the slide presentation. If you have questions, please feel free to stop me at any given time, but we will have plenty of time for questions. Not only if you have some, you can place them in the chat, or you can ask them while we're making the presentation and during the question and answer. So we'll go ahead and begin with that. First of all, what do these 2 disease states mean for us? And I think that's important that we specify them to our particular population. So let me give you a little bit of background. Hypertension and diabetes, it affects our community at a disproportionate rate than other communities. You heard that in the news, almost every health state, every chronic disease state affects the African-American community at higher proportions than it does other communities. There are reasons for that. Some political, some of them social, some of them economic, some of them relate to education. We have a lack of access to healthy food choices. So, a lot of you live in Cobb County. I actually live in Fulton. So, your access to healthy food choices. I don't have a Sprouts near me. I don't have a Whole Foods near me. The nearest one is approximately about 20 minutes away. And of course, those of you who have ever cruised those aisles know that is kind of expensive to shop at those places also. So that does make a difference. That's an economic impact. This is particularly what I am fighting in my second 20 years of practice. First 20 years was really about service and patient care. Now it's about leaving legacy and combating healthcare disparities. We have a lack of physicians and clinicians of color to serve our community. All the studies state the same thing. If you are served by someone that looks like you for your healthcare needs, you have better outcomes. All the studies say the same thing consistently, but yet we make up, between Black and brown folks, we make up approximately 30% of the population. We make up 10% of all the doctors. African Americans, period, make up approximately 5% of all the physicians that are active in the US. Of those, 2.3 to 2.4% of those are African American males. So you can understand, and those of you who are involved in 100 Black Men understand the need for mentorship, for development to try to combat this, because we don't have enough people that look like us to take care of us. And as I get a few more mango seasons under my belt, I understand the importance of that. I've been lucky because one of my best friends who I went to undergrad and medical school with is my primary care provider, but a lot of us aren't that fortunate. Also, when we look at this, just take medication. When we look at the studies, even COVID, there's been a lack of inclusion of our population in the research studies to know how efficacious these medications are in our population. That affects the way we respond and how we come out of these disease states. If you don't study us, if you don't know how the medications react to us, because they don't react to every population the same, how can you address our health disparities? How can you address our disease states properly? So let's talk about hypertension. Well, what is it? They call it the high blood. My grandmama calls it the pressure. You don't bring my pressure up. As with a long-term force, of blood against your arterial walls is high enough to cause long-term damage. So if you want to do a picture of that, if you'll take a long tube of ocean water and you force a lot of ocean water through there, it can go through there in a number of ways. It can go through there at a very, very steady pace, and there's not a lot of turbulence involved. It flows freely. But if you force a lot of energy through or a lot of volume through at high pressure, you'll create turbulence. As that turbulence increases, it creates damage to the vascular walls, and this is what starts cardiovascular disease. How's your blood pressure determined? It's determined by the amount of blood that your heart pumps out and the amount of resistance to the flow. So your vessels are that tube, and your heart is the pump of the ocean that pumps the water through your vasculature. And the thing about it, you can have high blood pressure for years and not have any symptoms, and that's why they call it the silent killer. So if you have symptoms, what do they have? Well, the thing about it is that most people don't have symptoms until it's very, very late in the process. That's what one of the problems is, and that's why preventative health, preventive health is very, very important to try to keep, because we have to take some ownership in our own health. There are certain things that we need to do to make sure that we're checking up on those things that may indicate some kind of problem. This is going to your primary care or having a primary care provider in the first place. And also keeping your appointments. I know that sometimes we don't tell you exactly what you want to hear. Sometimes we all hear the same thing, and I hear it too. We all need to lose weight. Maybe not Brother Robinson. I don't know if he needs to lose it, but the rest of us are always told that we maybe need to lose some weight. You should have a blood pressure reading at least every year when you're under the age of 35. After that, I think it should be twice or 3 times a year. So there are recommendations that come from the Preventive Health Services Task Force about how you should have maintenance and what are your screenings for certain disease states. Now, who are these based upon? A lot of times these are based upon majority populations, not necessarily our population. So I think there are general clinical facts, and I think there are Black people facts. So what I want to get across to you are the Black people facts. If you're over the age of 35, or if you have a family history of hypertension, or you know that you're overweight, or that you have a very sedentary lifestyle, you should be checking your blood pressure at least 4 times a year. Essential hypertension is what most people have. A lot of times it doesn't have a direct cause. It's what's called multifactorial that happens over the years. So a lot of times when you're in your 40s and 50s, and sometimes even 60s or and above, and get diagnosed with high blood pressure, what happens is that this is accumulation of what you have done over the last 30 years. So that little bit of extra cheeseburger, that extra little bit of Lowry salt, when you were going to grow perfecting your ribs, and of course you taste tested them, of course, and you love cooking those for your family, but what you did 30 years ago shows up now. And as you get older, especially when you're over the age of 65, your arteries harden. So they no longer are elastic. So if you think about the artery, if you take a rubber band and you stretch it, that is the elasticity of what an artery can do when you are younger. As you get older, it becomes very hard and it doesn't have that elasticity. So that's where, because you cannot, with the volume increases, when the pressure increases, because you can't adjust that, that's why you get high blood pressure. And a lot of times people can eat healthy and be smaller when they're older and still have some kind of high blood pressure, because they do not have that elasticity of their vasculature to combat that. There are other things that cause it: kidney disease, thyroid problems, some medications, illegal drug use. I spent quite a bit of time not only in the VA system but also in the correctional system, and a lot of times we would see heart attacks, cardiovascular disease in people that were extremely young. I'm talking about actual heart attacks, real heart attacks in 35-year-olds. Why? Because they started their illicit drug abuse. They started using cocaine, or at the age of 12 or 14. And over time, that damages your vasculature, and you can get high blood pressure and kidney disease and all the comorbid conditions that come from that. Now, what are the risk factors for hypertension itself? Age. As you get older, again, like I said, your vasculature gets firmer, so you don't have the elasticity. Race, us, we're at risk. Family history. If your mama had it, your daddy had it at a young age, you have to be more cautious. Our salt intake, that Lowry's, that little bit of extra salt, to give that flavor. It was like, but it's seasoning salt. The key word in that phrase is salt. So we should modify our salt intake. Alcohol, yeah, when you had that brown, over time, because you can, how you partied in your undergrad years and maybe in your 30s, sometimes if you went too hard, that can have a aspect to it also. Here's one that I'll speak about, especially at the end, just stress. Not only stress as a human being, but the stress of being an African-American person, especially a male in today's society and societies before us. That brings pressures that people really don't understand, that express themselves physically in your health. And we'll talk about a syndrome that is pretty well studied, but a lot of people talk about it, and we'll speak about that a little bit later. Now, what complications can you get from this? The heart attack, you know about stroke, heart failure. There are other reasons for heart failure, but that is one of the reasons. Metabolic syndrome, I call that the trifecta. So it becomes a slippery slope. So if you get hypertension, usually there's a reason kind of sort of why you have hypertension. So usually you have a little bit of high cholesterol. The hypertension plus the high cholesterol can lead to diabetes. We have a large waistline, men, especially gain their weight around their middle. And the bigger your middle is, the higher your incidence of having hypertension, and also all the other comorbid conditions that are mentioned here with the diabetes and the high cholesterol. And because of the vascular damage, your brain is full of vessels. That's how it gets its supply. That's how it gets its energy. That's how it functions along with the nerves. You can get the dementia because the thing of people say, well, our brains are full of nerves, but all those nerves have to be fed by blood vessels. If the blood vessels are damaged and the caliber of those blood vessels shrink, then it decreases the amount of blood that goes to your brain, thus giving strokes, and also has a incidence in dementia. So we'll talk about diabetes real quick. So very, very prevalent in our community. It relates to a group of diseases. There's type 1, type 2, youth onset diabetes. A popular one now is that came along probably in the last 15, 20 years is the pre-diabetes. There's a lot of people walking around there with pre-diabetes. It's like you don't quite, your blood sugar is higher than normal, which is usually because of insulin resistance, which is usually because of our weight and how we deposit our fat and how we metabolize our sugar and also our diet. You're on the borderline. That we didn't used to treat the pre-diabetes. We just kept monitoring you. But now we do treat the pre-diabetes because that is a wake-up call. The percentage of people that go from pre-diabetes to diabetes is over 70%. So there's something to watch out for. And also in our women, gestational diabetes that occurs during pregnancy, but that also predisposes you to type 2 diabetes later on in life. Now, when you have diabetes or get the diagnosis of diabetes, usually there are things that come along. You have increased thirst. I mean, you're thirsty all the time, and you urinate a lot, and you have to urinate a lot of times urgently. Sometimes people confuse this with the symptoms of benign prostate hypertrophy, but I mean, this is really urgent, and it's very simple to check. You do a urine dipstick, and you see sugar in your urine, and then you can tell and do the rest of the workup. You're extremely hungry a lot of the time. You have an unexplained weight loss. It's not that you've been trying to work out. It's not that you changed your diet. It's just that you just started all of a sudden losing weight with a lot of urination, and it's unexplained. So there's several things that can cause that, but this is one of the things that cause that. Fatigue, irritability, and you have a change in vision. If you have noticed, if you wear glasses, like most of us do, your prescription changes every year, but usually this is a sudden change. So you should definitely make sure you get screened for diabetes if you have a sudden vision change. Risk factors, inactivity, family history, age, hypertension, high cholesterol, and for women, previous gestational diabetes are some of the risk factors that attribute to this. What are the complications? And then you've heard of a lot of these complications. Cardiovascular disease, nerve damage, which is the neuropathy, usually happens in the periphery of the body, which is the feet, the hands. And from what I've been told in patients that I've seen over the years, it's significant. I mean, it's some real significant pain. There have been some advances in treating this, but once the nerve damage is there, the nerve damage and the pain is there, and nerve pain is a hard thing to combat. You can get kidney damage, dialysis. If you'll take a notice, and you might not notice it at first, but now start paying a little bit of attention. If you are in a predominantly minority neighborhood, or historically excluded groups, including the Latinx population. Notice how many dialysis centers there are compared to other neighborhoods. You may not have a Sprouts, but you have a dialysis center in the majority of African-American neighborhoods. We should take note of that. We should notice that. Well, we should really pay attention to that. You can get eye damage in your retina, which affects your vision. Again, foot damage. Matter of fact, my grandmother had uncontrolled diabetes. Unfortunately, rest her soul, she made the best coconut cakes after church that I can remember from my childhood. I swear, from that little kitchen, she came out with magic. But it cost her, and she would never obey her diet. She was like, "I'll be all right. I'll just eat a little salad today," and never got the proper care, and then ended up being a double amputee. So a lot of us have those in our families, and also depression. Again, if your vasculature is damaged, if your blood flow is damaged to your brain, there are going to be many side effects. One of those is mood. Is a change in mood. So what does all this mean for us with both these disease states? What are the implications? We have to be vigilant. We have to take some responsibility and educate one another. We have to be accountability partners. So important, so important. As they say, iron sharpens iron, as it is with men. So what we have to do is say, did you have your colonoscopy this year? Did you go get your checkup this year? You have insurance. I always joke with my wife is that her and the kids use my health insurance more than I do. And I shouldn't be saying that. That's probably not a good thing to be saying. So I have to take note of that. So let's go for our screenings. Let's make sure we have a relationship with our primary care provider. And I know in the time right now of managed care, sometimes the one you're assigned you really don't have a relationship with. Find one that you do. Find someone that you can talk to, that you can speak with openly. Because if we don't start, I would love to open up a partial clinic in a barbershop. I think that's a place where we are the most honest that we ever are. And I think that, we have to get to the point where we can talk about these things. Historically in our population, we don't talk about our issues. We don't talk about, erectile dysfunction. That's a taboo. I'm all right. I'm a man. I just, so you'd be surprised how many people did, after the conversations we have, come back and give me a side call for some Viagra at very, very early ages. I'm talking about in their late 30s, early 40s, which is, almost unheard of. So we need to be, and understand that, even if you get these diagnoses, they're not death sentences. Not if you take action. They're wake-up calls. They're time, it's call to action. These things can be reversed. Do you have a workout plan? Do you eat well? I mean, I'm a foodie like anybody else, and Atlanta is a hard place to be a foodie because you could go to a new restaurant every other week for the next 3 years and still not hit them all. But in moderation, understand it's not only changing your diet, it's not only changing your exercise pattern, it's changing your mindset about how you think about things. When you approach something, do you have it stabilized in your mind that, you know what, I really, really want that hot fudge sundae, or do I need it? Or do I just take one scoop and be like, okay, I tasted it, I'm good. I just wanted to taste it, I'm good. I'm going to go someplace else. Or that piece of chocolate cake is going to cost you an extra half hour on a treadmill. So we need to start changing our mindset. And as that is with most things that we, with high achieving people, we change, once you set it in your mind, that's what you're going to do, then that's what you have to do. But sometimes we have to be accountability partners for each other. Hey, brother, did you, when was the last time you had a full physical? I know you got insurance, you work with me. So what's the problem? Do you have a person that you can go to? Matter of fact, I know a person. Why don't you see my primary? I think he takes most of the insurances. He's a good guy. I think you can talk to him. I think you guys will get along. So we have to really, really manage to do that. And we have to do things like this. We have to educate each other. If you don't know, it was always said that if you know better, that you will do better. We have to educate each other on these. And it's okay if we don't know. We're not supposed to know. I don't know too much about accounting, but I got an accountant. I let him handle that. So I want somebody, you know, I want a blame partner. That's what I call them, because I said if something goes wrong, I'm blaming you because you're the accountant. I don't know anything about this kind of stuff. Same thing with your health. If you don't know how to eat, which most of us don't know or ignore the fact, which is probably what I do, is ignore what I'm supposed to be doing. I went to go see a dietitian because I was like, you know what? I think I'm so out of pocket that let's just start from ground zero and let's go back through, you know, what I should be eating, because there was a point that I was traveling for work 36 weeks out the year. There's nothing good about that the positive that can come out of that, except for hotel and airline points. That's about the only benefit to that. Other than that, so I went to see a dietitian to say, okay, what I need to know, I need to put a whole, you know, and you have to get yourself motivated to go ahead and start working out every day. The good thing about the pandemic is that, you know, I was only working out 3 days a week. Now I'm working out 5-6 days a week easily, just because I'm stabilized, I'm home, I got a routine, and it's to the point that if I don't get it done in the morning before I start working, I feel bad and I feel guilty. That's a good kind of guilt. So your conditions can be, you know, well managed, and the progression of them can be halted. Excuse the typo there. It takes education, effort, and it takes some work. It's not going to just come just because you did something good today. I ate a salad from Zaxby's. Zaxby salads are not healthy. So they have about 900 to 1,000 calories in a serving because of that, you know, that fried chicken tender that you decided to put on there, and then all the dressing that you decided to put in there. You know, let's get educated about what we're doing and how we're doing it. So again, you need to establish if you don't have a relationship with a primary care provider, please do so. Get referrals from your friends, from family members, from people you respect. People can help you. You need to establish that. You need to know what your baseline is. You know, we can't improve from any point without knowing what our baseline is. And that's what primary care providers do. They are the coach. You know, if you need to go get your colonoscopy, then you need to go ahead and do that. If you need to see a dietitian, they can arrange that. If you need to go to physical therapy for your back or certain medications you need, that's who would do that for you. You know, educate yourself on proper diet. I get on my millennial children for sometimes their lack of knowledge, because I said, I know for a fact that almost anything I want to know, I can get on YouTube and find it out. I didn't have that access when I was your age. You know, a lot of you are from the age of, how many of you had the encyclopedias back in the day that you begged your mom and dad to get encyclopedias, and then they were, by the time you got them, you know, I got the old version, so they were already out of date when we got them. But you can find out, there are thousands and thousands of YouTube videos on healthy diet, on exercise programs. Remember, exercise. Motion is lotion. Even if you have some kind of disability or some kind of chronic injury, there are ways that they even have modifications for anything you want to do. Modifications on push-ups if you have a rotator cuff injury. If you have knee problems, then you can't do regular squats. You do sumo squats because you point your toes out, because it decreases the pressure on that joint. Get that information. Ask somebody. You know, like I said, YouTube is an extraordinarily powerful tool, and the internet, period. Talk to your clinician and be honest with them. You know, we're really private as a culture. We don't want people to know your business. Unfortunately, this is one person you need to know your business. So whether, you know, if you're having any kind of problems, if you're having stool problems, if you're having back pain, if you're having erectile problems, you need to tell them, because we can't do anything about subjects we don't know about it. We're not here to judge. We're just here to help you. You know, managing your stress. I can't tell you how important that is. We are oppressed, you know, not only as men, but as African-American men, to strive, provide, as many of you know, we just had the verdict come out, you know, what kind of, just going through that and understanding what that means to our community. But, you know, of course, in my opinion, it was, okay, that was one, but what about all the other ones? What about the people that did, that died or were abused and couldn't speak up and didn't get their justice? So let's go ahead and manage that stress. So whether it's yoga, now I tried yoga. If you can do it, God bless you, because I can't. I ain't that flexible. My body just doesn't move like that. But the relaxation exercise, whether it's martial arts, whether it's kickboxing, there are all kinds of programs. Again, my wife introduced me to this thing called Fight Camp, and I thought it was kickboxing and boxing and all that kind of stuff in your home, and they give you a bag and all that kind of stuff. And I thought she did it for a little while, but I'm the one who got hooked on it. I got to have it like every other day. I'm on it. So whatever it is, whether it's playing ball, whether it's walking, let's make sure that we exercise. Motion is lotion. An object that is in motion tends to stay in motion. So, as you age, which is more important, most of the studies have said that, whether it's strength or whether it's flexibility, and as you get older, your flexibility is more important for longevity. So to make sure we are stretching, make sure we're moving, making sure we're getting cardiovascular health, making sure we're taking care of our diet. Stress is extremely important. So find a way to manage it. I know a lot of times, just as men, getting together in these groups, in these forums, whether it's with your fraternity, whether it's with 100 Black men, whether it's with your church, talking about the issues that are bothering you, whether it is, in your marriage or at your job, getting those things out and not holding them in. We're taught to suck it up. We're taught to, men just do. They don't talk about their issues. They don't complain. Well, it's not complaining all the time. Sometimes it's just venting and getting the issue out with somebody who can understand. And I think that's extremely important, and we need to do that. So yeah, and I think you already had a mental health forum, didn't you? So you understand how important mental health is. So let me just talk to you quickly about a syndrome called John Henryism. So basically, the stress of racial inequality can be very deadly, and I think it's very timely that we're having this talk on today with this verdict. So this, the story of John Henry, which is the story of African-American man that was working on the railroad and his battle against the machine in the 1800s. So around the 1970s, an epidemiologist named Sherman James, he began to study. He was out of Duke University, and what he was finding is that in African-American populations, there were higher incidences of cardiovascular disease in African-American men and who had high stress. And then he copied that and got the same results from African-American populations in even different countries that were under some kind of inequality stress. So basically, that hypothesis is that people who are facing prolonged adversity against inequality, financial hardship, racial discrimination, and the high effort coping, which is what we do, which is what we're trained to do, which is what we're said to do. Be a man, suck it up. Just put your nose to the grindstone and keep working hard. So what is required to thrive in that kind of environment will damage their health through stress. And what follows is a greater likelihood of cardiovascular disease and other problems. This is real. This is what we live every day. And, I don't know if many of you have heard about this syndrome, but it's prevalent today. It's as prevalent today as it has ever been. And again, we need to address those things that, being an African-American male in today's society does have a cost. So I just wanted to make sure that we talked about that, and brought that up, that, this is real. I mean, and again, we need to talk to people who understand that. Again, that's why these kind of forums and men talking to men a lot of times is very, very important, because everyone does not have the same stresses on them that are, people say, I can't say intangible, because sometimes the things you encounter, you feel them. You have a physiological reaction to what's going on, but you can't reach out and exactly touch it. All right, so we'll go ahead and that's questions and discussions. Just let you know that these are my two books. The one that's out now is In Spite of, Answering the Call to Lead. That is available on Amazon right now. And next month on the 10th, my second book is coming out, Living Your Best Doctor Life. So we will field any questions, concerns, comments.
Great information, Dr. Ramsey, great information. We do have a couple of questions that have come in through the chat. The first one is from Dr. Alvin Payton Jr. And he asks, can diabetes and or hypertension be reversed?
So it can be controlled. Unfortunately, when you have the diagnosis, you maintain the diagnosis. But yes, it can get to the point where you are on no medication. You are managing it through diet, exercise, and sometimes medication. So as far as reversal, you still, once you're diagnosed, you still maintain the diagnosis, but it becomes, instead of an active diagnosis, it becomes the history of. So it needs to be, you still need to keep it checked. You still need to get it maintained. You still need to keep a monitor on it, but it can be negotiated to the point where you don't have any medication and you have no symptoms and your blood pressure is very well controlled with just diet and exercise and stress reduction.
Okay. The second one is from Dr. Vaughn, and it is, can you give us pointers on how to manage stress? It's going to happen, so how do we deal with it?
Okay, so it depends on what kind of stress you're experiencing. So in general, so there's work stress and home stress. Some of those are dealt with a little bit differently. And actually, in both books, I kind of address the work stress. Sometimes you need to find out, what you enjoy about what you're doing and what you don't enjoy about your doing. So is it people? Is it process? Or is it policy? And fourth P is it position? So sometimes you need to, depending on how it's affecting your health, you may need to remove yourself from that environment. I actually had to do that from one of my positions. I mean, it was physically stressful. It was mentally stressful. I did not feel appreciated at all. And that's when, I noticed that my health was being affected. So I actually had to remove myself from that particular environment. And within a month, all of my indices changed. Blood pressure came down. There was, I really had no other symptoms. I didn't have any physical symptoms, nausea, vomiting, anything like that. So exercise is definitely important. I can't even tell you how important that is. Proper diet, relaxation exercises, meditation, prayer, however you kind of calm down your mental status, walking, actually laughing. I'm a big proponent of, I watch, there's really only two kinds of TV I watch, and that's comedy and adventure, but I love to laugh. And for me, that relieves my stress. So one good exercise I tell people to do is, when do you feel most at peace? What are you doing besides sleeping? And sleep is important, but when do you feel most at peace? Is it when you're fishing? I mean, I know some people that are avid fishermen, and that is their peace. When you're at the beach, I'm a beach goer. So, of course, on my retirement list is I got to have a place so I can see the water from my balcony. So find those things that, make you calmer, make you more tranquil, and make sure that you do those things. And if you need help, get help, because there's some situations that it's keeping you up at night. So is it changing your behavior? That's one of the keys. Is it making you more irritable? Are you losing sleep? Is it changing your appetite progression? Are you eating more than usual, less than usual? Are you spending more time alone? So if you're noticing that it's changing your behavior, then sometimes you need to reach out for help and get mental health professionals involved.
Okay, awesome, thanks. I also saw recently that the thresholds for hypertension have gotten stricter. So if anyone's kind of monitoring their own pressure at home or managing for a certain level, maybe there's some things that might need to change because of that. Can you talk about that at all? So
some of the thresholds have changed. They become stricter for diagnosis, but sometimes looser with age. So when you're younger, it was, right now, 120 over 80 was considered, it has to be below that. before we were saying, well, you don't really have hypertension until you're in your 130s and 140s, and your diastolic, which is the bottom number, over 100. But now, if you are not solidly with no comorbidities, now this is with you don't have high cholesterol, you don't have diabetes, you don't have anything of that nature. As long as you're under 120 over 80. Closer to, some people would say 110, but usually it's 120 over 80 and below consistently, then you're okay. Now, when you're older, what we used to do is say, okay, well, you needed to be under 140 over 90, because as you get older, we manage those parameters a lot of times with diabetes. We said that people that were older, especially over 65, 70 years old, we wanted their hemoglobin A1C, which is what you monitor to manage your diabetes. We wanted it definitely under 7. And a lot of times we were being so aggressive with our older people that we were causing more damage than we were doing good. So even the diabetes, the A1C on diabetes and the high blood pressure parameters have actually gotten looser for the older you get. Now, in that middle population, so they are pretty strict for those between 40 and 60 for the management of those. So that, we manage those pretty tightly just because of the longevity of life that you may have. We try to manage those more in a strict manner.
I'm having trouble hearing you.
Oh, sorry.
Thanks again. And let's see, I have another one here. So, throughout, I guess, the time, I've known some people that have been kind of hesitant, and there's some hesitance in the community around, beginning to take pills or the prescriptions for high blood pressure, because they say, once you get on, you never get off. And I've even heard of doctors, as a form of appeasement, saying, well, maybe you can take half a pill. So, do you have any patients like that, or you have any experiences or thoughts around that?
I have a lot of experiences like that. So, yeah, the good thing, one of the things I was taught in my training was that, by very, very respected physician that I know, was that, well, you try to do the absolute best thing by the book, but you're dealing with people. So if you can't do the best thing, you do the next best thing. And if you can't do the next best thing, you at least do something. This is where I say this is a delicate dance between patients and doctors. This is, it's a collaboration. What I can write every prescription in the book. If you don't want to take it, or you decide you don't want to take it, it doesn't do a darn bit of good. It does. So talk to me, negotiate with me. What we want to do is make progress. I can't expect perfection right off the bat, but if I can get what I'm trying to do is change your mindset and change your buy-in. So part of my negotiation with that would be, well, I'll tell you what, if you can show me consistently for the next 6 months to a year that, let's just take that your high blood pressure, that your readings, and I want you to take it, I'm going to give you a log. I want you to keep a log now. You can keep them in your phone. There are apps for that you can keep your blood pressure log in your phone. If your blood pressure is below this number consistently, we'll taper down your medication. And if it's consistently is below that again, I'll do a trial with you off of the medication. But if it goes back up, you're back on. So the responsibility is entirely up to you. Are you going to keep up the good work that you've been doing? Because we all fall off the wagon on everything. There's no perfect people on the earth. So a lot of times, you got your wake up call, and somebody puts you on some blood pressure medication, and he's like, you know what? I don't want to be on any medication. I'm going to walk 5 times a week. I'm going to start eating better. And it gets to the point where you're like, Doc, I was a little bit dizzy for the last couple of days when I was taking my medication. It was because now your blood pressure is a little bit low. Okay, we'll taper it down and we'll do a trial. Okay, 6 months went by. Maybe you went through something traumatic at work, that you changed jobs. Your children were getting on your nerves. You may have went through a divorce, so you gained 10 or 15 pounds. You stopped working out as much. So this process came back. So now, to protect you, not to punish you, but to protect you, I'm going to put you back on medication. I'm like, you know what? We got there before. Let's get there again. What were we not doing? I'm not here to judge you. I'm here to ask you a question. You were there. So what changed? Oh, Doc, well, this happened, this happened, and this happened. I said, okay, well, can we get started back again on the regimen that was successful for you? Yeah, I'm gonna do that. And I said, okay, let's work together and we'll get back to where you were. it's not rocket science. You did it once, you can do it again. Let's get on it. And I've seen that has proven pretty successful.
Okay, great. As far as blood pressure, do you recommend or suggest that folks have a blood pressure monitor at home? And if so, is there a certain time of day they should take it, or a frequency, before, after meals, etc.?
So two things. Let's just take, if you do not have a diagnosis of hypertension, you can have one around, but you can stop at any fire station. They do it for free. If you just want to do a random check, realize that blood pressure fluctuates throughout the day. So if you're going to do blood pressure monitoring, it needs to be about the same time of day every day. Studies have come out in the last 2 or 3 years that are pretty strong that, probably the most inaccurate blood pressure reading is that one when you come to the doctor's office. More accurate is home ambulatory monitoring. So your home blood pressures are probably more accurate than the ones that you get at the doctor's office, because you're in a relaxed environment. There's no pressure, but again, take those readings at approximately the same time of day. For people who do have the diagnosis of hypertension, I do recommend that they do have a home blood pressure monitor.
Okay. And we have another question in for the chat. This one is also from Dr. Payton, and it's, are blood sugar measurements for African Americans the same for other ethnic groups?
Yes. So uniformly, for the diagnosis of diabetes, so you have several ways to do it. If you have a random blood sugar testing and it's over 120, the reading is over 126, that gives you diagnosis. If you have a hemoglobin A1C reading of 6.5 and above, that will give you the diagnosis. So they are pretty standard. There are not stratified measurements for African Americans as of yet. Again, going back to the research question, even though we are affected more so than anything else, how we had research studies to see that how we manage it, or how we manifest it, or how our blood sugar regimen is registered is different from other populations. And there are not a lot of studies on that. But the good thing is that there's starting to be studies that go along those lines with the Satcher Institute here at Morehouse School of Medicine. We're starting to get the research arm is really, really ramping up. So I would say that within the next couple of years, we probably will have some really, really great comparative studies for majority groups versus our group.
Okay. Okay, we have a question here from Ms. Janice. When you log daily blood pressure, should your heart rate be kept as well?
I think it's a good idea. So sometimes your heart rate, depending on what you're doing and how you're doing it. So proper way is that you are in a seated resting position with your feet grounded for at least 5 minutes before you take your blood pressure. So what happens? That doesn't happen in our offices. What happens is that you come in the door, you come in, you sit in a chair, we take your blood pressure right away. Right away, that can give you an elevation of anywhere from 6 to 10 points. So you should. I think it's a good indicator, because when you have high blood pressure, you can have damage to your heart, and you can get the congestive heart failure. You can get the expansion and hypertrophy of your heart itself from the increased pressure over time. What that can do sometimes is give you conditions, what are called arrhythmias. You can get rapid, very, very rapid heartbeats, palpitations. And if you feel those, because there's some people that wake themselves up in the middle of the night and say, "Oh my God, my heart's beating so fast." You need to get that checked, because there's several conditions that can give you that. Whether it's in women, is more common, that is thyroid disease, some kind of thyroid disease, or hormonal imbalance. In men, it is mostly cardiovascular disease, and sometimes it's just an indicator of something else. It might not even be hypertension. You could have, especially in today's environment, you could have had COVID, and we're finding out now that you had COVID. People who had COVID, one of the sequelae from that is that you have congestive, like a dilated cardiomyopathy. We're starting to find that now. I'm sure we'll find out much more over the next year to a year and a half but there are all kinds of complications. So I think it's good. If it gives you that reading, I think you should take it. I also don't think it's a bad idea to have a pulse oximeter to measure your oxygenation, especially in today's day and time. They're not very expensive. They fit on your finger. They don't have any. There's no pain involved, and they're very simple to operate.
Okay, thank you. So I think we'll take a final question or two here. So now I've seen a new way of measuring your glucose or obtaining your glucose readings using an app on your smartphone to avoid finger pricks. Freestyle LibraLink. Are you familiar with this method? And do you have any thoughts on its accuracy versus more traditional methods, and et cetera?
So that is considered continuous glucose monitoring. So, but what they make it look like and what it is are two different things. So there is some interruption of your skin. Okay, there's a sensor that's involved in those that is inserted under your skin with a little needle, and that big thing that you see on TV, that's the cover and the receiver that sends the information to your phone. I think they are good. They are usually recommended for people who either have type 1 diabetes, or if they have type 2 diabetes or insulin dependent diabetes. They are on a high insulin regimen, and they either have frequencies of going really high or they have frequencies of going really low, and that's why they have to do the continuous monitoring. If you are on oral antihypoglycemics, probably that's not the that's not the recommendation. Just a more frequent hemoglobin A1C, like twice to 3 times a year, to kind of monitor what you're doing and adjust your medication if you're on oral medication. But I think that those are good because I pricked my finger a couple of times just for different stuff. It's not benign. I mean, I think I don't know if I'd rather get a blood draw, but I can take a blood draw over finger prick every day, or
Right.
3 times a day or 4 times a day. That's a bit much for me. So if I was on continuous insulin and that was a recommendation for me, I would definitely have the continuous glucose monitor without question.
Okay, and one last question here before I turn it back over to Art. At what point do you recommend medication for someone with blood pressure? And this is from Maurice.
Okay, so it depends. If you go back to strict criteria, depending on what your reading is, if you come in with a reading of over 150 or over 100, 9 times out of 10, you're gonna get medication pretty much straight off the bat, depending on what the situation is. If you're running in the 130s over time, I've sent you home with a monitor. You come back with the readings. Nowadays, people just shoot me emails and say, okay, well, this has been my reading, so I can determine whether you need a visit or not, or we can do a telemedicine visit to just discuss it. If it's, I'm aggressive, and depending on your age and your other comorbidities, if that's all you have is blood pressure, you get a little bit of leeway. But when you start getting in the systolic blood pressure above 140s, and I haven't been able to get it down by dietary modification, exercise, and relaxation within 2 to 3 months, then 9 times out of 10, I'm going to put you on medication until you can do better. Because the thing about it is that it's kind of like the time value of money. The greater damages are over time. They're not immediate.
Awesome. Well, on behalf of the 100 Black Men of North Metro Atlanta chapter and everyone in attendance, I want to thank you for sharing your medical knowledge and wisdom with us this evening. You've given us a lot of actionable information that we can use to help prevent and manage hypertension and diabetes. And at this point, I'll turn it back over to Dr. Vaughn.
All right. Well, thank you again, Dr. Ramsue, for spending time with us this evening. Thank you, everyone else. There's any number of things you could have done with the last hour of your life. I think I saw Brother White doing sit-ups during most of the thing. I think that was him exercising. But we appreciate this knowledge that you're sharing. As I mentioned before, we've had people speak on prostate disease, heart health, mental health, COVID-19 vaccines, access and availability. And this is just another one of those great virtual health and wellness conversations sponsored by the 100 Black Men of North Metro Atlanta. As the flyer on your screen shows you, a lot of the conversations we've had are about things we can control. about our diet and exercise. We can't control everything, but there's certain things we can mitigate by what we put in our mouth. So next month, what we're going to do is have Chef Patrick Clayton come right before we get to Memorial Day and you guys break out those grills. And he's going to say, how can we cook healthy on the grill, but it still tastes good? So next month, we'll be talking about healthy grilling. We're going to have a live demonstration and presentation. We hope you all will join us next month, May 18th at 7 p.m. It feels like it's right around the corner. But again, I want to thank everybody for giving up an hour of your time this evening. Again, thank you, Dr. Ramsue, for your time and knowledge. And we look forward to seeing everybody next month. Have a great rest of the night and rest of the week. And again, thank you all for joining us.
Thank you.
Thank you, everyone.
Have a good evening.